Thank you for this opportunity for me to talk about sudden infant death syndrome, or more importantly, how you can prevent your baby from dying unexpectedly from sudden infant death syndrome, or SIDS. SIDS is one of the leading causes of death of healthy babies in the United States because we do not have babies dying of malnutrition or infections. However, if you use the back position, the incidence of SIDS is very low, approximately 0.5 per 1,000 births. It is certainly important for you to do several things to lower your baby's risk for crib death or SIDS. First and foremost is when you put your baby down for sleep on their back. It's probably just as simple as their face is up in the free air and they do not run the risk of suffocation if they are on their tummies. Next, have all loose items, blankets, stuffed animals, anything that the baby can get their face caught into, remove that from the crib. So simply when you place your baby down for sleep on their back, place them on a nice firm mattress and remove all excessive items out of the crib or the bassinet. Secondly, have that bassinet next to your bed at night. We do know that mothers and babies share biorhythms and you teach each other how to arouse during the night. We do know, statistically speaking, having that bassinet next to your bed lowers your baby's risk for SIDS. It also makes it convenient for breastfeeding. When your baby gets hungry, you can bring your baby into bed with you, breastfeed your baby, but before you fall back asleep, you place your baby in their own sleep area on their back next to your bed. Obviously, do not smoke during your pregnancy, but also do not allow smoking around your baby. Smoke has carcinogenic side products to it. Also, the nicotine exposure statistically does increase your baby's risk for sudden infant death syndrome. Statistically, we do know that if you introduce a pacifier to your baby, it does lower the risk for SIDS. It may be as simple as they're practicing oral, mouth, head, neck control when they work sucking on that pacifier. Simply introduce the pacifier, allow them to work with it, and if they spit the pacifier out, then that's okay. But the introduction of the pacifier to your baby during sleep has been shown to lower their risk for SIDS. There are some parents that are concerned that the introduction of the pacifier may interfere with breastfeeding. So Academy of Pediatrics certainly agrees during the first week of life, make sure that your breastfeeding has been established. And for those parents who choose to use a pacifier or introduce a pacifier to their baby, they can do it at that time when the baby has demonstrated good breastfeeding skills. We know that if you inadvertently overheat your baby, you will increase their risk for sudden infant death syndrome. Keep the room temperature at a comfortable level. Do not purposely overwrap your baby. Just have them in a sleeper that is comfortable, buttons up here, no caps at night that they can pull over their face and trap their air movement through their nose. If it's during the winter months and they need a blanket, have the blanket underneath the arms so that they can't wiggle underneath the blanket. But do not purposely overheat the room and do not purposely overwrap your baby because that can increase their risk for sudden infant death syndrome. Thank you for choosing St. Francis Eastside for the delivery of your baby, and thank you for listening to me regarding suggestions for SIDS prevention and to lower your baby's risk for sudden infant death syndrome.